My friend recently passed away.
What happened?
He passed away from a pulmonary embolism. You're taking Bio14 with Professor Vizzoli, right? Can you explain how somebody can die from a pulmonary embolism?
Sure, I can do that. There's an open lab. We can look at some models and I'll explain it to you. The thrombus in this reenactment will be dislodging off the right femoral vein and traveling up the external iliac vein. Then to the common iliac vein, and then to the inferior vena cava. Now we will move to a model that shows the heart and the lungs. The thrombus will travel from the inferior vena cava to the right atrium, through the atrioventricular valve into the right ventricle, then through the semilunar valves into the pulmonary trunk. Now we will cover the arteries that Professor Vizzoli wants students to know for the first lab exam. Ascending aorta carries blood out of the heart. Aortic arch makes a U-turn. Brachiocephalic trunk, the first major branch of the aortic arch, carries blood to the right side of the head and the right arm. The common carotid arteries carry blood to the head. The external carotid artery, external branch of the common carotid artery. The internal carotid artery, internal branch of the common carotid artery. Superficial temporal artery, superior extension of the external carotid artery. Vertebral arteries branch from the subclavian arteries. Basilar artery formed by the merging of the vertebral arteries. Ophthalmic artery branches from the internal carotid to the eyes. Lingual artery next branch up from the external carotid artery. The superior thyroid artery, inferior branch of the external carotid artery. The occipital artery, the external carotid toward posterior. The maxillary artery from external carotid toward the maxilla. The subclavian arteries carry blood toward the right and the left arms. The subscapular artery supplies scapula and dorsal thorax. The axillary artery, what subclavian becomes at armpit. Superior thoracic branches off the subclavian artery. The thoracoacromial artery supplies shoulder and pectoral region. Anterior circumflex humeral artery serves muscle near shoulder. The posterior circumflex humeral artery serves muscles near shoulder. The brachial artery in arm axial becomes brachial artery. The lateral thoracic artery supplies lateral chest wall. The profunda brachial artery, also known as a deep artery of the arm. The radial artery, brachial splits in lower arm. Radial recurrent artery. arises from the radial artery, distal to elbow. Ulnar artery, brachial splits in lower arm. Ulnar recurrent artery arises from ulnar artery, distal elbow. Common interosseous artery branches off ulnar artery. Superficial palmar arch, superficial anastomosis. Deep palmar arch, deep anastomosis. Thoracic aorta, name of the aorta from T5 to T12. Internal thoracic artery arises from subclavian artery, feeds anterior body wall. Anterior intercostal arteries supply intercostal spaces anteriorly. Abdominal aorta, name of the descending aorta below T12. Celiac trunk, most superior branch of the abdominal aorta, feeds organs in the upper abdominal quadrants. Renal arteries branch off the abdominal aorta leading to the kidneys. Common hepatic artery, right branch from the celiac trunk. The right gastric artery enters stomach from common hepatic. Left gastric artery from celiac trunk to superior stomach. Gastroduodenal artery enters intestine from common hepatic. Right gastroepiploic artery branches off the gastroduodenal artery. Left gastroepiploic artery. Hepatic artery proper, name of common hepatic at liver. Splenic artery from celiac trunk to spleen. Superior mesenteric artery, middle branch of the abdominal aorta. Inferior mesenteric artery, inferior branch of the abdominal aorta. Gonadal artery, abdominal to gonads. Common iliac artery, aorta splits at pelvis into these. Internal iliac artery from common iliac inside pelvis. External iliac artery from common iliac to the rest of the leg. Femoral artery. External iliac becomes femoral in thigh. Popliteal artery, name for femoral artery in the knee. Posterior tibial artery, medial posterior branch of the popliteal. Anterior tibial artery, anterior branch of popliteal. Peroneal artery, lateral posterior branch of popliteal. Dorsal pedis artery, extension of anterior tibial artery in foot. Arcuate artery, dorsal arterial anastomosis. We hope you enjoyed our video.